Welcome to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome back to a new episode of Ask the Patient Advocate podcast. Today we're exploring healthcare through a unique lens, one that combines governance, compliance, patient advocacy, and lived experience. I'm honored to welcome Dale Atkinson, founder of Clear Signal Partners. Dale developed the Patient Trust Audit, a methodology that examines healthcare organizations from the perspective of real patients to identify where trust breaks down and how those gaps impact patient outcomes. What makes Dale's perspective especially powerful in his own journey is his own journey. After spending nearly 2 decades building trust frameworks in highly regulated financial institutions, he was diagnosed in 2024 with stage 4 esophageal cancer. Suddenly, he found himself navigating healthcare not as an observer, but as a patient. Through that experience, he discovered significant communication and trust gaps that affect patients every day. Welcome, Dale. I'm so excited to have you on today. How are you doing?
Well, first of all, just to say thank you for having me. It's a genuine privilege to be here. I also just want to say at the outset, it's slightly strange to be sitting in this seat, being that for most of my career, I was the one auditing systems from the outside, not the one depending on them from the inside. So I apologize in advance if some of what I say is a little bit blunt, but that's sort of
No, I
why.
love that.
I mean, I've seen it from both ends of the table.
Yes, no, I love the bluntness, and I think this is such a needed project and task that you've taken on. It's one that is way overdue. I don't know why it hasn't been done before in the capacity that it needs to. I will say, being on the other end as the patient is such an eye opener, and I've experienced it myself, and it's quite shocking because as a healthcare provider, you think you kind of know what's happening, and you're like, oh, it's the system is bad, but then when you see it from the patient side, you're like, oh wow, it's really really bad. That's kind of what threw me into patient advocacy. So, I want to hear more about you. I'm sure our listeners would love to. So, you've spent years helping major organizations build systems of trust and accountability. Then, almost overnight, you became a patient navigating one of the most challenging diagnoses imaginable. Can you tell us about that transition and what surprised you the most?
Yeah, so I think the honest answer is what surprised me the most was just how little, well, yeah, how little of what I'd sort of taken for granted in finance actually existed in healthcare. So, I
Yeah.
mean, for nearly 2 decades, I worked across global financial institutions, building systems that are meant to catch the problem before it becomes a catastrophe. Controls, audit trails, accountability. Someone whose job it is to sort of follow up. That was me. And when something of real magnitude goes wrong in a bank, it triggers a review. People ask how it happened and basically how to stop it reoccurring. And then you build systems around that. And then almost overnight, I'm sat in a room being told I've got stage 4 cancer. I was told it was inoperable, incurable. I was given a prognosis of less than 12 months. I think I was given 11 and a half months initially. And what struck me wasn't the actual diagnosis itself. It was realizing how much of the coordinating, the chasing, the holding the thread, quietly falls on the patient themselves, not on the doctors, not on the system. And we're the very least, the person very least equipped to do with it, to do it. We're frightened, we're unwell, we're in shock from the diagnosis, etc. And in my world, from the finance side, that would be a massive control failure. That would be something that would be logged, would be dealt with, and would be seen as a systemic problem and a failure. But in healthcare, that's just an ordinary Tuesday, and that gap is more or less what I've spent sort of the time since trying to name and deal with, and that's where this all came from.
Isn't it amazing that like I wouldn't say all, but most other industries have all these like logistic processes and, organized flows and plans and checks like you're saying. And then healthcare, I don't know what happened. Like they just got it didn't get the well-oiled machine like all the other
Yeah.
industries have. And I always wonder like why, because just like you're explaining it, it's very common for a patient that's an engineer or worked in accounting or anything like that say like, what do you mean there's no process for this? Or what do you mean I don't do anything next? Like how is this possible? It's almost like unthinkable or unimaginable because it seems so like far off that a system that's so important in like dealing with people's lives isn't properly set up for the
Absolutely.
checks and balances that it needs. And I don't know. I'm so happy that there's like it's being highlighted now that there is that deficiency in the system. I really hope that more and more measures are taken to make differences with it.
Yeah, me too. Absolutely.
So trust is a word we often hear, but it can mean different things to different people. When you talk about healthcare trust, what exactly are you referring to?
So I think that's a really fair challenge, being that the word often gets sort of misused, and a lot of people view it as, whether the doctor was nice to me, and that's not really what we're talking about here. So, in my view, and in the view of what we've created, trust isn't just a feeling. It's whether the promises a system makes are actually kept consistently at every point the patient touches it. It rests on, a few very simple things, from competence to reliability to honesty, and whether the incentives are pointed in the same way as the patient's interests. So, the practical test I use is the gap between what's promised and what's actually delivered. That could be whether the left hand is talking to the right hand, whether your medical files make it from one team to another, whether there's somebody within the clinic, within the healthcare business you're dealing with, who actually knows your whole story. And that then trickles down into things like whether their website, whether their email promises they'll come back to you in 24 hours, 48 hours, etc. And it's chasing up whether they do. When somebody says that they'll have your results as quick as they can and that they're chasing them, it's checking whether they have or not. It's essentially, looking at whether the system has picked up and done exactly what it said it's going to do when it said it's going to do it. And in our view, when it doesn't, that isn't just sort of rudeness. It's actually a breach of the patient's trust. It's a breach of essentially the sacred responsibility that a doctor has to their patient to tell them the truth. And we are trying to measure that via what we're looking at and how we quantify trust.
I think that's so interesting and important because it happens so often that I see in the healthcare system that it almost becomes the norm. Patients will be waiting for like a very important results, let's say like a biopsy results or something like that. And they say, oh, it could take a while, but we'll call you as soon as we get them. But then the patients will, there's a lot of transparency now with patient portals and things like that. So patients will see results and then a week or so will go by and they still haven't heard anything. And they're trying to decipher it on their own, which they're not really equipped to do so, right? So it causes a lot more anxiety and definitely a loss of trust. So I think that is so important to further evaluate and investigate because it is something that patients definitely deal with and like very, very often in healthcare.
Absolutely. And it's part of that we're trying to measure here, especially in terms of the communication breakdowns.
Oh, I love that. I think that's so needed. So many people think communication issues are merely frustrating inconveniences. But you've argued that communication failures can have real consequences. So what cost do these breakdowns create for patients? Let's further kind of dive into that.
I mean, first of all, I'd probably highlight that they're not really inconveniences, they're outcomes. And sometimes those cost lives. I
Sure.
mean, take my own case. So I had reflux for probably about 7 or 8 years. They kept handing me PPIs, so protein pump inhibitors.
Mhm.
People on here will probably know it as omeprazole or pantoprazole or whichever other one you want to be prescribed. Um, and they effectively filed it under a bad lifestyle and stress. Nobody stopped to connect the dots. And I mean, I was having shooting pains up through my shoulder. I was having shooting pains in my chest. I was having gut issues. I was in general pain all over the place, as well as having acid reflux during my sleep, as well as these little symptoms all over the place. And nobody stopped to go, wow, that could actually be one singular thing, not lots of different pieces. And by the time they actually bothered to look at it properly, and I say bothered in a way that I probably shouldn't about doctors, because I do love the NHS in the UK. That's our healthcare system here. They are fantastic when it works, just sometimes it doesn't. But when they actually stopped to look at me properly and to look at all the symptoms, it took one doctor to piece it all together. And bingo, they found a stage 4 cancer. And it was, inoperable, incurable, too late for them to do very much. But what I really want to highlight there is it's not really the story about one bad doctor. It's a story about a system that didn't follow its own thread. And the cost of that sort of landed on me in full. But there are also lots of quieter costs too, especially when it comes to communication. Things like when a patient's made to feel like a nuisance for asking questions, the
Sure.
patient stops asking. They stop chasing things up. They stop caring about themselves because it doesn't feel like the doctor cares about them. It doesn't feel like the system wants to know. And often, especially when you look at things like my case, where I use adjunct therapies, that often means that things happen behind the scenes. I think there was a recent statistic across Europe that 52% to 56% of all patients use adjunct therapies outside of the system. Now, that includes off label medications, as I used in my journey. And some of those, there are incompatibilities with mainstream medications. For instance, I recently presented at HIMSS, and one of the case studies I used as part of my presentation, part of my speech at the Healthcare Information Management and Systems Society conference, was about a lady who I actually met a little while ago, who it turned out was pre-diabetic, was taking a number of drugs that affected her liver function. And because her doctor had made it very clear that they didn't want to hear anything about anything she was doing outside of the system, she had bought metformin online. And unfortunately, she ended up landing herself in hospital with lactic acidosis. And very sadly, for something that was so highly preventable, had there been communication in place, had it not broken down between her and her doctor, and had her doctor not made it clear that she didn't want to hear about these things, this lady ended up in hospital having lactic acidosis and sadly passed away as a result of it. Her liver just went into failure and her whole body collapsed on her. And this was something that could have been very easily managed through open communication between the doctor and the patient, something that should have been there and should have happened all along.
Absolutely. Oh, that's a great example of a terrible outcome for sure. It is terrible that patients are so turned off and like nervous and kind of not willing to want to voluntarily go to get help through the healthcare system for a variety of reasons, um, like the trust that you mentioned. It's just terrible that patients have to feel uncomfortable to approach the healthcare system because unfortunately it's becoming unapproachable for many reasons. And you've experienced healthcare from every angle as a governance expert, as a patient, as someone navigating both public and private healthcare systems. So, what have you learned from managing your own cancer journey?
So I think there's two things that sit slightly in tension, but I think both are kind of true. Let me have a crack at trying to put both of them out. So I think the first is that you need to be the CEO of your own healthcare. You need to keep your own records. You need to ask for the actual data, not a summary, not what your doctor tells you in a meeting,
Sure.
because in often cases, they are summarizing down information that they haven't fully digested. You are one of a very long number of patients they are seeing that day. And sometimes they miss things. Sometimes they don't pick up on things that they really should. Sometimes they don't have your full medical history in mind or in front of them, and they forget things and they don't look at interactions and they don't look at all these bits and pieces. Whereas you, obviously, as you who's experiencing it, do. And you will be the first person to pick up, if, like in my case, they were trying to give me 20 milligrams of a steroid, which I hadn't consented to and didn't need in any way, shape, or form. But somebody down the line had thought, I'll just put this on the sheet and it's fine. And had I not been listening when the nurses were doing my medications, I wouldn't have picked it up and I would have had this steroid, which would have caused me a lot of other problems down the line, especially due to the interaction with some of the other drugs I was taking. So I think, first of all, you need to be the CEO of your own healthcare. You need to take control, and nobody's going to care about your case as intensely as you do. So you can't really outsource your own survival. So it's important that you end up, self-advocating, taking agency in it, and looking after yourself. And then the second, and I think I'd be remiss to say this, is that you can't do this alone. I mean, for me, I'm here in part because I was carried by my partner, by a small circle of friends, by the protocol I was committed to, by my integrative oncologist, my naturopath. All these people really helped along my journey and they supported me when I couldn't do it myself. And I mean, all of that's supposed to say is my most recent scans show that I have now no visible disease. And I'm
Oh,
hugely
that's
grateful for that.
wonderful.
But I'm not naive enough to stand here and call it all over. I genuinely can't tell you with certainty why I'm still here. And I think if I'm being honest about it, that uncertainty matters more than the answer anywhere along this, because the alternative is selling people false precision, and that's its own kind of broken trust.
That's amazing. And I think you nailed it perfectly. Explained it so well. And congratulations on, being in remission. That's amazing. It's definitely been a challenging journey, I'm sure, for you, but you've
Well,
seemed
not quite
to.
remission yet. I'm no
Yeah,
visible disease, not yet no evidence of disease. So one
that's
step
great.
away still.
That's great. That's great. Well, you're well along the way. And many patients hesitate to seek second opinions because they worry about offending their doctors. This is something that I get asked so many times. Like, is it okay? Will my doctor be offended if I get a second opinion? They're almost scared that if they try to kind of look elsewhere, that perhaps their doctor will not want to help them anymore. I have my opinions on this, but what's your perspective on second opinions?
For me, and I'll be very blunt, my view on this is completely
Mhm.
unambiguous. A second opinion isn't an insult in any way, shape, or form. It's just basic diligence.
I agree 100% with that.
I mean, in finance, you wouldn't make a material, irreversible decision on the strength of a single reviewer. You'd have it checked. You'd go, if the stakes are that high, you'd have it checked multiple times by multiple different parties. And yet, we ask people to accept a life or death decision on one opinion and then feel guilty for looking for a second. And to me, that's really backwards. So, as I see it, any clinician worth their salt actually should welcome a second opinion, because if they're right, it confirms it, and if they've missed something, well, everybody would rather know. And sitting as a patient, I definitely rather know if my oncologist has missed something, and it helps them to improve for future and all these things. That to me, there is no way that it is a bad thing. So, I mean, all of that to sort of say, I'd only really put it one way. If a doctor is genuinely offended that you've sought another view, I mean, that reaction in itself is a trust signal, and it's not a good one. Seeking a second opinion, I mean, it arguably saved my life more than once. And it's how I ended up on sort of, you know, testing and treatment route that worked for me. So what I'd say to the audience is, please don't let politeness cost you. Your doctor will be fine. They really won't feel insulted. And if they do, they're probably not the right doctor for you anyway. And, it's you who's going to end up in trouble if they are wrong. So better to seek one than not.
And I couldn't agree with you more. My approach and my response is usually like, if your doctor or provider is offended, then they're probably not the one that you want on your care team, because they
Absolutely.
don't have your best interest at heart. It's more so seems like a ego type thing and so forth, or whatever the reason may be. It doesn't seem like your best interest is put forth, and it does happen. So it's not just something like patients are worried about and it doesn't happen. Some providers do get offended, so it's a fair concern, but it
My
shouldn't
doctor
be.
did.
Yeah,
Sadly, my oncologist got quite offended when I sought a second opinion. So it's something I've become quite used to and had to handle myself. And it's not pleasant when it does happen, but sadly it does.
yeah.
Um, so it's just a case of taking it on the chin, making sure that you understand why you're doing it, and making sure that you limit the damage that it causes.
Sure, absolutely. Well, Dale, I'm sure our listeners would love to know more about you and your work and how they can connect with you. Where can people find more information about you and the work that you're doing?
Thank you. Yes, the consultancy is Clear Signal Partners, and that's where the Patient Trust Audit lives, which is the methodology we built for looking into healthcare organisations through the eyes of a real patient, finding trust breakdowns, etc., etc. And that is www.clearsignalpartners.co.uk. Although we do operate globally. And then in terms of where you can find me, so I'm most active on LinkedIn. I'm simply there under my name. I think it's Dale J Atkinson. And I also write a bit more personally about things on my blog as well. I've got a blog called thelifeorganic.com. So for anyone navigating their own diagnosis rather than running a clinic, I'm also doing a book. There's also lots of podcasts out there. There's also a charity which I'm setting up with a lady called Jane McClelland, who many of your readers will probably know from her book, How to Starve Your Cancer. So there's lots and lots of ways to find me. please just Google me and pick one, and you'll find me quite easily.
Oh, that's wonderful. I love that. Dale, your perspective is incredibly unique because you've experienced healthcare from both sides of the table. As someone who built trust systems professionally and as someone whose life depends on them personally, one of the biggest takeaways, in my opinion, from your conversation is that trust isn't a soft skill in healthcare, it's a critical component of patient outcomes. Clear communication, transparency, follow-up, and patient-centered care areas aren't extra. They're essential parts of the healing process. So thank you once again, Dale, and I hope our listeners feel more confident as they navigate their healthcare journey. Have a great day. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.